In this video, I'm going to address strabismus, sometimes mistakenly called a lazy eye. Hi, I'm Dr. Moshe Roth. I'm a developmental optometrist, board certified in vision development and vision therapy. It's common for people to make the mistake of calling an eye that turns in or turns out a lazy eye, but in fact it's not. These two terms are frequently confused and interchanged as though they're the same. Strabismus is an eye that turns in or out. Amblyopia is when information from one side or both sides hasn't developed. These are actually two different things that are frequently confused. In a different video, I addressed what amblyopia, lazy eye, means, and I'd encourage you to view that. In this video, I'm going to address strabismus, an eye that turns. What is strabismus? Strabismus falls into one of three categories. I'm going to demonstrate this by using these two pens to simulate where the eyes are pointing. Exotropia means that one eye points in while the other eye points straight. Exotropia means that one eye points out while the other eye points straight. Vertical strabismus means that one eye points up or points down while the other eye points straight. Doesn't surgery correct strabismus? Many people think that surgery corrects strabismus. It does not, and that's why people often have multiple surgeries. And usually after 2 or 3 surgeries that haven't worked, they tell the surgeon, no more. The reason that surgery almost never works is because the eye surgeon is trying to move where the muscle is attached to the eye. But it's the brain that controls where the muscles point. In order to address strabismus, you have to address the source, the brain, and re-educate the brain to send the signal so that the eyes can point where they should be pointing. Once the brain sends the information to the eyes to point straight, then the eyes can send the correct signal to the brain so we can make sense of that information. Strabismus can be constant or intermittent. The eye can turn all of the time or just some of the time. When it occurs all of the time, we call that constant strabismus. So one eye is constantly turned out or constantly turns in. When it occurs some of the time, we call that intermittent strabismus, meaning some of the time it's turning in and some of the time it's straight, or some of the time it's turned out and some of the time it's turned straight. Is it always just one eye? Some people can alternate. That means sometimes they look with the right eye and the left eye turns out or turns in, or sometimes they can alternate, okay? Meaning that they can use either eye. We also measure how much the eye turns. That's called magnitude. Esotropia means that one eye turns in, and that can often lead to amblyopia or a lazy eye. Exotropia, meaning one eye turning out, rarely leads to amblyopia. The results of either one is that our brain gets 2 different pictures, and it can't put the 2 pictures together as one. The amount of deviation is often different when somebody looks far away than when they look up close. So it may be different when looking at the board in school as opposed to reading a book. When we talk about distance, we mean about the distance the board might be in school. When we talk about near, we mean where we hold a book, or read, or look at a computer or a cell phone. When the two eyes don't point in at the same spot, then the brain gets two different pictures rather than being able to put those two together. What does suppression mean? Our brains don't like it when we see two different pictures. So to avoid that, the brain may turn off the picture from one eye inside the brain. That's called suppression. When someone can't turn off the confusing picture inside the brain, they may actually cover one eye with their hand or with a patch, or they may study or read with their eye over their hand. Sometimes they may turn their entire head. How does strabismus affect someone in the real world other than just how they appear to others? When a child turns off the information from one eye in order to reduce that confusion, then the information from that side doesn't develop. That's when strabismus, meaning an eye turn, then causes amblyopia, a lazy eye. It's like a flower seed that's planted into poor soil or doesn't get enough water. It just doesn't develop. When vision doesn't develop, then it's very hard for someone to judge depth. Depth means the awareness of where things are relative to where we are. If someone doesn't have or doesn't develop depth perception, it's hard for them to catch a ball or judge the distance between cars when driving. It can then cause someone to get into an accident or have trouble parking a car. It can cause someone to be clumsy. If a child has difficulty in using the two eyes together, then usually they don't want to play team sports such as soccer or baseball because it's hard for them to tell where the ball is or where the other players are relative to where they are. And it's hard for them to position their body or arms in order to catch the ball. Sometimes they may be physically hit, so they avoid that in order to protect themselves. And at times, they may be emotionally hurt because other children may laugh at them. Strabismus can make reading and studying a lot more difficult and even fatiguing. It may not be obvious when somebody's looking at someone that they have an eye that turns, and that's why it's so important to bring in a child early, similar to a well baby visit. Does strabismus only happen in childhood? Sometimes these problems happen in childhood, but sometimes it occurs after an accident, or after a stroke, or due to a body disease such as diabetes. We call that acquired strabismus. At times, someone may have just been on the verge of having an eye turn and just holding on to that by using a lot of effort. And they may still be able to control it, but at some point they just decompensate, meaning that they can no longer hold it and it becomes manifest. Manifest means that it shows up much of the time. I hope I've given you some valuable information and have helped simplify a complex issue. We're just hitting some of the highlights in this video. How can this be fixed? And is the fix permanent? Fortunately, there are ways that we can help someone if they have an eye that turns in or turns out or turns up or down relative to the other. We can even help people that have had poor outcomes after strabismus surgery. Vision therapy, prism, and syntonic phototherapy are ways that we're able to help somebody gain or regain the ability to use the two eyes together as a team. Please consider calling our office at 732-679-2020 and scheduling for an examination. I'd be happy to help. I'm Dr. Moshe Roth. I'm a developmental optometrist, board certified in vision development and vision therapy.